Mr. President.
Senator from Washington.
Thank you, Mr. President. Mr. President, earlier this year, I heard from an elementary school principal in Washington State about how the opioid crisis was hurting the kids in his school. Students at his school were having trouble focusing in class as they dealt with the trauma of a family member's substance use at home. And some of his teachers were having trouble understanding how best to help those students with their trauma. I also heard from the staff at a hospital about how they deliver so many babies to mothers struggling with opioid addiction, many born with neonatal abstinence syndrome battling the symptoms of withdrawal. And I have heard from countless other families across my home state of Washington about how the opioid crisis has impacted their loved ones. Our communities have been crying out for action to address the root causes and ripple effects of the opioid crisis that has caused so much heartbreak for so many people, and today we are making an important step to answer that call. The legislation that we are passing today includes a wide set of policy solutions from both sides of the aisle to help tackle this problem from many different angles. Many people helped craft this legislation and offered their own valuable insights, ideas, and solutions, and I am grateful to all of them. And I especially want to thank the committee leaders in both chambers who did so much to bring this together. Senators Wyden and Feinstein, Senator Alexander, Senator Hatch and Grassley here in the Senate, and Congressman Pallone and Neal and Nadler and Walden and Bradley and Goodlatte over in the House. And I'm also grateful to Leader Schumer and Leader McConnell and several others who were particularly helpful in this process. And I want to thank Senators Heitkamp, Donnelly, Markey, Hassan, Casey, Manchin, McCaskill, Baldwin, Nelson, Kane, and so many more. And of course, I want to thank my staff and the many other members of staff that worked on this as well. The bill that we all crafted together is a meaningful, bipartisan compromise. As always, it's not what I would have written on my own, and I know it's not what my other colleagues would have written on their own, but it is a collection of impactful, common sense solutions where we were able to find common ground. Ideas that respond to the root causes and the ripple effects that our communities are facing. It includes support for state efforts to improve plans of safe care for children born to mothers battling substance use disorders, like those at the hospital that I visited. It ensures the health department is implementing strategies already identified to protect moms and babies from the effects of opioid substance use. It includes provisions to develop a task force and grants to help support trauma-informed care programs and increase access to mental health care for children and families in their communities, including at schools like the one that principal told me about, and provisions to build on critical public health activities to prevent opioid misuse from occurring in the first place. It includes provisions to address the economic and workforce impacts of the opioid crisis, like support for training to help the nearly 1 million people out of work due to opioid use disorder to gain and retain employment, as well as provisions to strengthen our behavioral health workforce so that patients and families can access the treatment they need. It continues meaningful grants that help states address the most pressing problems associated with substance use disorders in their communities and makes those grants more flexible and available to our tribal communities who are suffering deeply with the impact of substance use disorders. It expands access to treatment services by making more providers eligible to prescribe medication-assisted treatment. And it includes provisions to help the Food and Drug Administration address the crisis as well, like giving it new authority over packaging and disposal of opioids, as well as many other steps to help those on the front lines of this epidemic. I'm glad that we can include so many voices in this discussion and that it led to a bill that offers so many ideas to address the different angles of this crisis. And I look forward to seeing this bill become law so it can start helping our families and communities as we work to reach everyone impacted by this nationwide fight against opioid use disorder. This is an important bill, and it is an impactful step forward It is not a final step by any means. The opioid crisis is ongoing, and our efforts to address it must be as well. So I'm going to keep listening to people in Washington State about what they need to respond to this crisis, and working with my colleagues here in Washington, D.C., to provide the resources and solutions that will help to make a difference. I urge my colleagues to support this important legislation, and I yield the floor.
Mr. President.